Hello and welcome to Can Community Health. I'm your host, Alex Redmond. You may not know, but Florida is at the top of the list for new HIV cases. And the sad truth is that 1 in 7 people living with HIV don't even know they have it. But now, hope comes in the form of a little blue pill. No, not the one you may be thinking of. This one greatly reduces your risk of an HIV transmission. Today, we're joined by David Weiland-White. He is the PrEP coordinator of Can Community Health, and registered nurse Casey Homer. Welcome to the show, guys.
Thank you. Thank you, Alex.
Absolutely. Thrilled that you could be here because it's a great opportunity to educate some people about PrEP. And many people haven't even heard of PrEP. So what does PrEP stand for?
PrEP stands for pre-exposure prophylaxis. Simply, 1 pill a day prevents you from becoming HIV positive.
This is a really great thing because many people out there are negative. They don't know their status, but the people that are positive don't know theirs either. So this is a prevention. It helps to prevent you. And how on earth was this discovered?
Over 10 years ago, there was about a 10-year clinical trial that happened. One of the trials was IPREX. They were testing HIV positive, negative couples, zero discordant relationships. And what they found out by giving the person who was HIV negative 1 pill a day and HIV medication, they weren't becoming HIV positive.
So they took the prophylaxis, or they took the Truvada for PrEP along with their HIV positive partner, and they stayed negative.
Correct.
That's amazing.
And the FDA in the United States approved it in 2012.
So it is now FDA approved. And well, who should be on PrEP? Is it because many people think that HIV is specifically just a gay disease? It is not. It affects whom?
Okay. I answer this to everybody. Everybody should be on PrEP. Well, that's my personal feeling. When it comes to PrEP, those that are partaking in high-risk behaviors, what I mean is those that are sexually active, IV drug users, sex workers, and anybody that is having sex should be considering PrEP, because the one main component about PrEP, it's not just a gay disease, it's also straight disease, and one quarter of the new cases were in the straight community. So, and it's from people who don't know they're HIV positive.
Well, let's talk about that. We're talking about straight people now. Straight people, gay people, trans people, bi people. That brings us to Casey. You work a lot as a registered nurse at Can Community Health.
Yes.
You work with people that are HIV positive,
Yes.
and you also work with people that want to stay negative. Talk about women and HIV and their risk.
Well, there's women, and it was discussed that, PrEP is for gay people, straight people. It's, for everybody all around, but it's also, let's not forget, people who are in relationships where their partner is positive. They definitely need to consider being on PrEP.
Can you give us a scenario? Give us a scenario.
As far as women are concerned, it could be a woman who is married and her partner's been positive and they've taken other precautions over the years, condom use, or what other options may be out there besides just remaining abstinent. They have an option now to take PrEP, and then they can, have a fulfilling marriage. But there's also single women, women who aren't quite positive if their partner's remaining, monogamous with just them, and women who just are dating multiple people, not in a serious relationship, and just out there.
Well, let's be real about this. I mean, honestly, many people don't think that their partner is going to be unfaithful. It's not something that in everyday life we actually think is going to happen. So this is the type of thing where if there's even a glimmer of the fact that your partner may not be faithful or monogamous, that you should probably be on PrEP. Do you think that that's the better alternative than just wishful thinking?
Absolutely. And there's also women who have open relationships and they know that their partner is with other people. So it goes both ways.
Because I don't think that anybody that ever gets an HIV transmission believes that this is something that they were going to get. I mean, David, you have a compelling story. Please share.
Okay, so this was 24 years, coming on 25 years ago. I was in a committed relationship with a gentleman that we tested, we practiced safe sex for 2 years. Then I went for an HIV test because I was doing it faithfully every 6 months, and he had told me that he went for an HIV test and that he was negative. For 3 years after that, we were having unprotected sex, and I was still testing HIV negative every 6 months. At the end of the relationship, when we broke up, I went for a life insurance policy, and I came up HIV positive. I was only with one person for 5 years. So at that point, I'm like, dial the phone, honey. We need to talk. And at that point, he had shared that he lied to me, that he had been positive for 10 years previously before I got together with him. And that the reason why he chose to lie to me was because he knew that our relationship would not go forward if he told me he was HIV positive. He completely removed my choice. So because of that, my passion has been working in HIV prevention, education, and trying to help as many people as possible not become HIV positive. And that's why I reach out to those that are in relationships. 80% of marriages, first-time marriages, end up in divorce. A good portion of those are getting cheated on or are spouses that are not in a monogamous relationship, or they choose to step out. So.
And again, by all means, Casey, drink some water, please. So getting back to the fact that 1 in 7 people doesn't even know that they are HIV positive. That means that people are walking around and they haven't been tested. And a big part of that, and we'll address that in coming shows, is stigma. And of course, you don't want to not get tested because of stigma, because embarrassment or fear of maybe being rejected by your family. Nobody ever died of embarrassment, and it's better to be alive and make new friends and be healthy and be in treatment for HIV than that. If there was one thing that you just wanted to drive home about being on PrEP, what's the one amazing thing that you've seen?
Take responsibility for your sexual health.
Yeah.
And what does that mean?
What that means is I cannot rely on you to be honest to me. What that means is I take responsibility, I make the choices for me, I empower myself. There is something out there, the other blue pill that I talk about now, and it's PrEP because I run the program. That gives me the power, and that gives the individuals the power to know that their chances of contracting HIV have been dramatically reduced. And it's about taking responsibility for yourself because nobody else is going to do that.
How difficult is it for somebody to get on PrEP? Is it a really big challenge, or is
No, it is one of the easiest things. At Can Community Health, where I work, we have programs that work with the non-insured patients. We have programs that work with the insurance patients. We have just about anybody. If you walk through the door, I can probably get you on PrEP.
No barriers.
No barriers. The only barrier is getting the people in the door. And that's what this is about.
Do you think the biggest thing is that people just don't know about this particular little blue pill?
Yes. In our area, in the southwestern part of Florida, for a year we did research. We went to the different festivals throughout Sarasota, Manatee County, and we found out that 92% of the individuals that we had surveyed, and these were thousands of surveys, did not know about PrEP. And it's been out since 2012.
Before we go to a break, here's a little background on Can Community Health. We are going to take the scary out of medical, particularly when it comes to HIV, hepatitis C, and other STDs. We're going to make HIV a normal part of the everyday conversation and replace it with information, facts, and hope. So stay with us. We'll be right back. Florida is #1 for beaches.
The Sunshine State also leads the nation for new HIV cases.
The opioid epidemic makes the fight against HIV and hepatitis C more challenging.
Minorities, women, young people,
And seniors are most affected by HIV.
But you can get tested.
You can get diagnosed.
And you can get treated.
CAN offers hope.
For information, call or visit us online.
Seniors, this one's for you. I'm Bob Trissolini. We don't talk about it, but seniors are at a high risk for HIV, hepatitis C, and other sexually transmitted diseases. You know that little blue pill that kind of puts us in the mood? Well, sometimes we don't practice safe sex. Many are walking around with HIV and Hep C and don't even know it. So protect yourself. You can get tested. You can get diagnosed. You can be treated.
Can Community Health. Welcome back to Can Community Health. I'm your host, Alex Redmond, and we're speaking with David Weiland White. He is a PrEP navigator, and Casey Homer, a nurse with Can Community Health. And you guys are raising some great awareness about PrEP, which is a preventative for HIV. Now, here's a great question, though. Is it enough to just take this 1 pill a day regimen and then you're going to remain HIV negative if you're with a positive partner or you come in contact with someone in an intimate relationship that is HIV positive? Is it enough to just be on PrEP?
No. Along with PrEP, you should also be practicing or partaking in sexual risk reduction. A lot of that is with condom usage. And then what we're finding out is many of the clients that are coming in, there are many partners or people in the industry. People are not just having sex with one person. So what we do is we ask them to take responsibility for their sexual health, try to know their partners, try to stay with the same people that they're playing with, not to get into the anonymous sex, and just kind of narrow their arena. And there's other areas too along with that. And make sure you're using condoms. Make sure you know the people that you're involved with. These are some of the main issues that we try to push.
Why aren't people more aware of the fact that a condom will help to reduce your risk of an HIV transmission and also PrEP? Why, Casey?
I think people are aware that condom use will help. I think they don't like that condom use will help. For the most part, just in the clinical side, when interviewing patients and seeing them for their visits, when you ask about condom use, that's their answer, no.
Who's saying that?
Our patients.
But who? Give me some rundowns of some
23-year-old male with 7 partners. What is your condom use?
What about seniors?
Yeah, no, but yeah.
No. Seniors, no.
Married women or women in a relationship
people are
with a
not
man?
a fan of condoms.
Why is this, though? What's the resistance? And what about young people?
Our 13 to 24 age group, those that are coming out of high school, we have some local high schools that won't even talk about condom use. They're not allowing that conversation to happen.
Yeah.
So when I'm fighting a political system, I don't want to fight a political system. I want to help you to help yourself.
Okay, but some people, I guess, might use the argument that when you are suggesting that people use condoms, young people, that you're saying, okay, go out there, young people, and have sex. But perhaps this is a different thing, because we do teach young people to look right and look left before they cross the road. It doesn't mean that you're telling a youngster, a toddler, to cross the road without a parent or without looking right or left. The same thing with having sexual relations, being intimate with someone. You're saying that young person, when the time is right, because many of us do not plan for the first time. In fact, I would probably guess that the majority of people don't plan the first time they're actually intimate with someone. You don't put a date on your date book and a time, right, and go out there and say, this is the day and the second and the time that I'm going to go out there and have sexual relations with someone. So people probably should be prepared, because no parent wants to hear a child come home because they didn't use a condom and or possibly get on PrEP with someone that they were planning on being intimate with and tell them I'm HIV positive.
The one constant with the HIV cases that are out there is the 13 to 24-year-old group keeps on growing. It has not detracted. We do not teach sexual health to our adolescents. And because of what you brought up, when it comes to talking about condom usage, that means I have to talk about sex. Adults don't want to talk about sex with their 13-year-old. Adults don't want to talk about their sex with the 15, 16-year-old. Unfortunately, there's a taboo in the United States, let's not talk about sex. And that really stifles a lot of these numbers, and the statistics show it. The 13 to 24 age group is the one group that continues to grow in HIV cases.
So I guess the question that parents would be better off asking or talking to their child about is about sex rather than HIV and how to deal with your HIV transmission now.
Yes, and you need to gauge your relationship with your child too. Some parents can have that full-on discussion with their children, and some can only say, you know, when that time comes, I need to give you the resources so you can protect yourself. Because our community resources outside of ourselves that can help, so that if they feel more comfortable with a stranger, they're still going to protect themselves. So if you've got a relationship with your child that's different than the next person, that's what you have to gauge.
Right, let's talk about before you actually start taking PrEP. Are there certain things that you should be tested for to make sure that you don't have them before you get on PrEP, and
Absolutely,
why?
absolutely. The first thing you need to make sure that you is HIV negative. You don't want to start on PrEP and you're HIV positive. Everybody needs to know their status. We test for hepatitis B, syphilis, which is also on the rise, 70% last year. Gonorrhea and chlamydia. Chlamydia very often is asymptomatic. People won't know that they have it, they find it, and they were unaware. Gonorrhea and chlamydia are tested in the throat, in the rectum, and also in the urine, okay? And that needs to be done prior to the patient starting on PrEP, as well as a basic profile to make sure that your liver enzymes are good and your kidney function as well. And those same tests are also repeated every 11 weeks while you're on Truvada to ensure that you stay negative, make sure there's no other STDs that need to be treated, and that all of your chemistries are staying where they need to be.
And let's talk about pregnancy too, because people may not know that you should or you shouldn't take PrEP when you're pregnant. What's
Okay. When it comes to, usually we run into this when we have a positive negative couple. One is positive, one is negative, and they're trying to conceive a child. Now, when they actually conceive the child, then they're pulled off of the medication because it could be detrimental to the fetus. So with that, basically, if you're working on maternity needs, we're going to run into this. The other part that would happen, that if women are on PrEP, we give them a pregnancy test. We need to make sure that they're not, they haven't conceived, because we do not want to do damage to what? Casey, which our family
that would be a part of the every 11 weeks for a female.
Right, in case people didn't realize it, the lovely Casey over here is actually pregnant. How far along are you now?
I'm 26 weeks.
26 weeks, so that's great. Wonderful, congratulations.
And what I learned about Truvada when studying is that it's safe, as far as HIV patients were concerned, it was safe in the first trimester and not further than that. So if a PrEP patient ends up pregnant, we test every 11 weeks anyway, so it wouldn't get into that danger zone for them if they were on Truvada.
Now, if somebody's thinking about getting pregnant, let's talk a little bit about that. Should they be taking Truvada for PrEP?
Yes, because you're dealing with a positive negative couple. And to protect yourself, this is what PrEP is about. If you're in a positive negative relationship, PrEP alone can help you retard the virus or not contract the virus, but it's recommended that you use condoms along with the PrEP to equal like 99% effectivity. Now, those, like I said, that are working on maternity needs, that they're trying to get pregnant, you have to have sex without protection. And PrEP is the one way where the negative person is going to remain negative.
Yeah, that's your only protection left.
That's your only protection left.
But again, PrEP should be used in conjunction with a condom for much better protection. And how much protection does that offer, David?
99%.
99%, so that's pretty good.
When you're using condoms and you're using PrEP together, it's 99%.
About 92 with just the Truvada, is that correct?
Yeah, 92 without
with
condoms.
Just Truvada, 92 with just Truvada, and 99% with a condom and Truvada.
Condoms, if they're used properly 100% of the time, are only 97% effective.
Right, and just to clarify for our audience out there, Truvada is the same medication that's used to treat HIV, and when you call it PrEP, you say Truvada for PrEP, because this was originally found that when there was a couple where one person in the couple was HIV positive and the other one was HIV negative, they put both of the people on Truvada, and what was found was that over time, the negative partner remained negative, and that's how they first found out about the benefits of that.
Yes, and by doing that, they took the research even further, and it was called the IPREX trial, which happened over in the UK. By doing that, they actually tested positive and negative couples. They expanded the study into IV drug users, and they expanded it into heterosexual sex, and they found out, and also with the sex workers, by taking Truvada, it dramatically reduces your chances of contracting HIV.
And of course, transmitting HIV is the reason that it is out there so much, and that Florida is at the top of the list for new transmissions.
Correct. And we've decreased that number by over 1,000 new cases, just on the latest statistics alone.
Well, I think it's really important that we try to get that number down in the state of Florida, but not just Florida, all over the United States, because there's no need, with the knowledge that we have and the tools that we have, to stay HIV negative, which are condoms and Truvada for PrEP, otherwise known as PrEP. You know, everybody seen those commercials now, 1 pill a day. You know, it's just that 1 pill a day.
Yes.
What would you prefer, 1 pill a day or an HIV transmission where you might actually have to take 30 or 40 medications a day?
Okay.
No, we'll talk about. We're going to
yeah.
talk about that. We will talk about that. We're going to go ahead and take a little break now. And when we come back from break, we're going to be talking again with David Weiland-White and Casey Homer about PrEP. It is that 1 pill a day that's going to help keep you HIV negative. So thanks for watching Can Community Health. Stay with us, and we're going to be right back. You can go to our website for more information.
Hi, I'm Dickie Smothers. You may know me as one of the Smothers brothers, and then again, maybe not. That's not why I'm here. I'm here to talk to you about something serious. Hepatitis C. No laughing matter. It can lead to cirrhosis of the liver, even liver cancer. Baby boomers are most at risk. You could have Hep C and not even know it. You can get tested, you can get diagnosed, and you can get treated. Hep C can now be cured.
For information, call or visit cancommunityhealth.org. Florida is #1 for beaches.
The Sunshine State also leads the nation for new HIV cases.
The opioid epidemic makes the fight against HIV and hepatitis C more challenging.
Minorities, women, young people,
And seniors are most affected by HIV.
But you can get tested.
You can get diagnosed.
And you can get treated.
CAN offers hope.
For information, call or visit us online. Welcome back to Can Community Health. I'm your host, Alex Redmond, and we are talking about that 1 pill a day that can help to keep you HIV negative. We're joined by David Weiland-White. He is a PrEP navigator, so he is the person that you want to talk to if you are going to try Truvada for PrEP, otherwise known as PrEP, and Nurse Casey Homer. All right, guys, so before we went to break, we need to get this information out there because we were talking about the difference between taking 1 pill a day, PrEP, to keep you HIV negative, as opposed to what happens when you get an HIV diagnosis. How many pills might you have to take?
I was taking 12 to 15 pills a day. I have had over $1 million put into my health care that I added up right when my leukemia started. I contracted leukemia, which was an HIV form of leukemia. I have lost body parts. I've lost a bursa pad. I've had boils that had to be operated on. I've been in the hospital 12 different times for boils. And when the leukemia, I was actually in the hospital and I was going to be sent home to die with hospice. So when people ask me what's the difference between 1 pill a day with PrEP versus the medications on HIV, they're saying it's the same. And I look at them and I tell them, no, it's not the same. 1 pill a day will protect you from going into the hospital. 1 pill a day will protect you from having your health monitored. I was at a point where I was seeing a doctor once a week. I got so frail in the process of going with leukemia. My gums had rotted out, my throat was rotting out, and I had lost 35 pounds in a matter of 2 weeks.
So your choice basically now, because this is not meaning you, but I mean your choice to our audience out there, what would you prefer? Would you prefer to put yourself at risk of HIV and go through all that? And by the grace of God, David, you are doing very well now, and you are saving people's lives and changing lives, which we thank you for so much because you're getting the information out there. And by the way, if you'd like to reach out to David Weiland-White and Can Community Health, you can go to cancommunityhealth.org, which is the website, cancommunityhealth.org, or you can simply give us a call at 844-922-2777. That's 844-922-2777. And also, if people go online, David, I'm sure that you have need for people out there that also want to make a difference, maybe PrEP navigators?
Yes. Our organization is expanding and we are growing beyond belief. Right now we've got PrEP running in 6 clinics. We have 2 more opening up in the next couple months. We have slotted another 4 clinics that are going to be starting PrEP over this next coming year. It's amazing what this organization does.
And Casey, there was something that you really wanted to get out there about women and privacy, because there are women out there that just, they really don't want anybody to know that they are going out there to get a prescription for PrEP.
Absolutely, women and men alike. But if you are in a home or a marriage or relationship, a situation where you don't want anybody to know, your health is your privacy, and we take that very seriously. Nobody needs to know you're coming for appointments. Phones aren't going to be called that you don't want called. Mail won't be sent to your house. You know, we'll do our part to keep your medical visits with us and your medical history completely confidential, and nobody in your home will know. Don't let that be a barrier by any means to, you don't have to take home documents or paperwork or anything like that. So this is something that you can make a decision to do on your own, that you can keep to yourself. Your partner doesn't have to agree, and they don't have to know.
And you're doing something good for somebody else, because you will stay negative and you will not be transmitting HIV.
Correct. And there are many partners out there, you get that feeling in the back that your partner might be cheating on you, but you don't want to admit it. So this is the one way that you can take, even if it's not on the table or is on the table, you have that question in the back of you, what's going on here? So why confront the relationship? We have a lot of people that don't want to lose the relationship, but yet they know they need to protect themselves.
And nothing's going to happen to your partner just because you are on PrEP, right?
Exactly.
Yep.
So how hard is it? Because a lot of people they think, I don't want to be bothered. It might be very challenging to get on there. Break it down for us. How hard is it?
You call, you make an appointment, you come see me or one of the many PrEP navigators that we have. We sit down, we educate you on the PrEP program, we set you up for a medical appointment, Casey sends you out for labs, and then once we find out that your organ function and everything is fine, then we give you a prescription.
It's that simple.
That
Yes.
simple, yeah.
So I'd like to ask both of you the same question really quickly, though. What is your biggest hope when it comes to PrEP and HIV?
For people to take responsibility for their own sexual health and to help stop, number one, help stop the spread of HIV.
And David, I would guess, I would beg to ask you the same question.
Protect yourself. Nobody else is going to do that.
That's
You
right.
have to take responsibility for yourself.
And so get on PrEP?
Yes.
Yep.
All right, well, you've heard it from David Weiland-White, also Casey Homer. I think, well, actually, let me ask you one more quick question. You have kids.
Yes, ma'am.
What do you say to your children? How many kids do you have?
I have 2.5 of mine that are my own. I do a lot of scare tactics with the kids, as any mother would. Absolutely.
You talk to them
Always
about
have.
PrEP, and you
I
talk
am
to them
very
about
open with
sex?
them. Actually, when I started with this organization, we had a rep come in and they brought us some cards that had facts. And I told the kids, remember those?
Yeah.
And
What did you tell them?
I let them play with them, and they said, "Oh my gosh, I had no idea," because it really broke down the nitty gritty. And I tell them what's out there, tell them what it looks like, tell them what it doesn't look like, and I tell them to protect themselves.
That's it.
Yep.
So we want to thank you guys for all the information you shared today, and
Thank you.
thank you for taking time out of your very busy day to join us on CAN Community Health. We'll see you next time.